So good afternoon. We're here today to provide an update on COVID-19 vaccine distribution and to make several announcements about priority groupings that will be eligible for vaccines starting next week. When vaccines first arrived in December, our administration prioritized healthcare workers to protect our hospital system and immunize the people who've been working on the front lines of this virus for the better part of the past year. Next, we prioritized residents and staff of long-term care facilities, and then first responders, and we also vaccinated individuals living in congregate care settings, many of whom are among our most vulnerable residents here in Massachusetts. Our goal has been to protect and preserve life and support our healthcare system. On February 1st, we opened eligibility to residents 75 and older, and we've seen significant progress over the past 2 weeks to get shots in arms to that community. Massachusetts administered 285,000 total doses last week, exceeding the weekly shipments we received from the federal government. More than 251,000 residents 75 and older have gotten the first dose of the vaccine. This is over half of the statewide population that's in this group and exceeds the national average for this age group, having been vaccinated as well. There are hundreds of sites across the state that are open where eligible residents can get vaccines, including mass vaccination sites in Danvers, Springfield, Foxborough, and Boston. And 2 more mass vac sites will be opening next week, or before the end of the month. One's next week. Are they both next week? In Dartmouth and in Natick. Residents can schedule appointments at these sites. At regional sites, we have several terrific regional collaboratives. At pharmacies, retail pharmacies, some of which are standalone and some of which are inside other retail outlets, community health centers, and at some local boards of health. 95% of the Massachusetts population lives within a 45-minute drive of a mass vac site or within a 30-minute drive of a regional site that's represented by a high-volume provider. We've also made improvements to the booking process by developing new tools on our website and opening a call center to assist residents who can't book appointments online. So far, we've administered here in the Commonwealth with our provider partners over 1.1 million doses. We now rank number 9 in the country for first dose vaccinations per capita, and the Commonwealth is ranked number 1 in the country for total shots administered per capita among the 24 states that have more than 5 million people. Thanks to all that progress, effective Thursday, February 18th, individuals 65 and older and individuals with 2 or more certain medical conditions will be eligible to get vaccinated. We also added asthma to the list of medical conditions that can qualify for this group. Secretary Sutters will share more details on the full list in a moment, but they will be available on our website. Starting Thursday, eligible residents can visit mass.gov/COVID vaccine to book an appointment. It's important to note here that new appointments will appear on the website starting tomorrow morning around 8 a.m. There's no reason to stay up all night. These 2 groups that we're now opening up the vaccination process to represent approximately 1 million people. It's important to remember the federal government only sends states a small amount of vaccine every week. For the last several weeks, the federal government has shipped about 110,000 first doses per week to the Commonwealth of Massachusetts. Unless we see a massive increase in shipments from the feds, it will take us at least a month for people in these new groups to be able to book their first vaccine appointment. And believe me, we all know this sounds like a long time, but the demand is so much greater than the supply that we're getting at this point in time. We all remain hopeful that those numbers will increase from the federal government as we go forward, but it's important for people to understand that at this point in time, it's about 110,000 new doses a week for first doses, and we now have a group that represents somewhere around 1 million people that's going to be joining the ranks of those who are eligible. As soon as we get official guidance from the feds that we're getting a bigger supply, we'll be ready and we'll make sure to incorporate that into the delivery community that we've been working with, and we'll obviously let everybody know so that they can take advantage of that. But until then, we have to ask everybody to be patient. There's going to be vaccine eventually for everyone, and everyone will get an appointment. It's just going to take a little while. And I know for a lot of people, that's an enormous source of frustration. And while our weekly supply shipped to Massachusetts from the federal government is steady, our administration continues to build capacity to administer shots at more and more locations so that people have more places to go, but in addition to that, we'll be ready if and when the federal supply on a weekly basis goes up. Tomorrow morning, thousands of new appointments at MassVac sites will be posted online for booking for the following week. Over 70,000 appointments will be available at the mass vaccination sites, and other appointments will be posted throughout the week for sites like pharmacies and some of the regional collaboratives. Details for booking these appointments can be found via the new COVID-19 Vaccine Finder, which allows residents to search for a vaccine location and view appointment availability at many sites before scheduling. After many days of very interesting conversations with our colleagues at CVS, starting this week, the number of appointments available at CVS locations will also be visible through this tool as well. And the tool can be accessed via the state's vaccination website at mass.gov/COVID vaccine. People who are unable to use the website to make an appointment via the internet can continue to call 211 and follow the prompts for vaccine appointments. Again, I know this is the third time I've said it, but over 1 million people will now be eligible. But if we continue to only get 110,000 first doses of vaccine each week from the feds, it will take a while, at least a month, for everybody to get appointments and get their first vaccination. And as I said earlier, Massachusetts is now a top 10 state for first doses as we continue to ramp up and move forward. This is particularly important for communities that are disproportionately impacted by COVID-19 to ensure equity statewide. Over the last few days, the Command Center and the Department of Public Health have started new initiatives to improve and increase access and help communities who are hit hardest by the pandemic. Utilizing the CDC's Social Vulnerability Index as a starting point, the Department of Public Health has identified 20 municipalities that have had the greatest COVID burden and the greatest percentage of non-white residents. These communities are Boston, Brockton, Chelsea, Everett, Fall River, Fitchburg, Framingham, Haverhill, Holyoke, Lawrence, Leominster, Lowell, Lynn, Malden, Methuen, New Bedford, Randolph, Revere, Springfield, and Worcester. DPH Commissioner Monica Burrell has reached out to all of these communities so that the state can work with them to assist them in increasing vaccine awareness, addressing vaccine hesitancy, and mitigating barriers to vaccine access. And the administration will also work with their local boards of health to streamline access and increase efficiency. Our goal is to build more efficient vaccination sites regionally that can vaccinate people more quickly. Secretary Sutters today began working with local boards of health who've been offering small-scale vaccine clinics to begin transitioning these operations to serve homebound seniors, individuals who participate in Meals on Wheels programs, and others who are unable to travel on their own to any of the vaccine sites that are currently available. Where there's a geographic need, the state will also work with local boards of health to set up additional regional collaboratives, which have proven so far, the ones that are in place, to be enormously effective. Lieutenant Governor Polito will talk more about that. The 20 hardest hit municipalities that I just mentioned will continue to distribute vaccine at the local level, are prioritized for retail pharmacy programs, and are served by community health centers, which are also prioritized, and other healthcare providers administering vaccine. As we move forward through the vaccination phases, we need to continue to make sure that we have locations that can distribute the doses quickly and efficiently and effectively. What worked for the early targeted populations in Phase 1 is a lot different than what's going to work for the millions of people across the Commonwealth who are eligible in Phases 2 and 3. We're enormously grateful for all the healthcare workers and personnel who helped us stand up all these vaccination centers, and that work has made Massachusetts a top 10 state for vaccinations. But we all know we have a lot more to do and a significant way to go to get to the point where everybody who wants a vaccination can get it. None of us thinks this program is moving fast enough, but you can't vaccinate people if you don't have the vaccine to make it available. But we do expect and anticipate that we will see an increase going forward from the feds, which is why it's important for us to have significant capacity in place to be able to make quick adjustments based on weekly supply. And as I said, beginning tomorrow, with an additional 1 million people eligible to receive the vaccine and 70,000 new appointments coming online, the amount of new appointments will be limited unless and until we see significant increases from the feds. For people who are seeking to make an appointment, remember to be patient, because as I said, it may take at least a month for everybody who's part of this new group to get an appointment and to get their first vaccination. Visit mass.gov/COVID vaccine to use the appointment finder tool and find a vaccination site that's convenient for you. And everyone that wants a vaccine will be able to get one. Everybody who gets an appointment will be able to get a vaccination. And we just need to make sure that we work through the supply we get as quickly, safely, and as effectively as we can so that we can be in a position to continue to meet the targets we've set for ourselves as we work through these phases. And with that, I will turn it over to the Lieutenant Governor.
Good afternoon, and thank you, Governor. Today we are pleased to announce that residents 65 and older and residents with 2 or more certain medical conditions will be eligible for the COVID vaccine beginning tomorrow, Thursday, February 18th. Since vaccines arrived in the Commonwealth, our administration has been working hard to build a vaccine infrastructure system and necessary resources to help residents in all communities to access appointments, ensuring equity and efficiency. Working with our local officials and local boards of health is an integral part of our process. Our administration has been working closely with our cities and towns throughout this distribution process to make sure we can get vaccines efficiently to as many residents as possible. Local health officials have been on the front lines of this pandemic since day one, and helping your residents, our residents, navigate questions and concerns about COVID and providing local support have been part of your daily operations. We are so thankful for your efforts to stand up these vaccination clinics over these past several weeks and serving so many of your residents, and we are so grateful to our local officials for their ongoing efforts to support our communities. You have done a tremendous job, and I know how hard you are all working. Again, we are so grateful and thankful for your efforts and for your partnership and your collaboration. Today, moving forward into the next eligibility group in the distribution process, 1 million new individuals will become eligible for vaccines. The allocation Massachusetts receives each week from the federal government remains constrained, as the Governor outlined. As more people become eligible for the vaccine, we must ensure that there are high-capacity sites available in locations that have unmet needs geographically and can offer at least 750 appointments per day. This is where our regional collaborations come into play. We want to continue to empower our communities to provide more resources to their residents. And as former local officials, the Governor and I know that locals know their communities best. Our administration will continue to support our municipalities in areas such as promoting vaccine acceptance, providing telehealth, town halls to distribute appropriate and pertinent information, and develop messaging campaigns in multiple language. We also will work to plan, develop, or coordinate vaccine programs for residents living in public and private low-income and affordable senior housing, and identify and organize vaccination of homebound residents who are unable to access any other vaccination program as they become eligible. These efforts will help ensure that we are reaching the most vulnerable residents who might be housebound or otherwise unable to visit a mass vac site or a larger site. The COVID-19 vaccination effort is the largest and most complex vaccination program in this country's history, and its success depends on all levels of government, federal, state, and local, working together to make this a success. We are thankful to all of our partners who have worked hard to vaccinate individuals in the Commonwealth thus far. We've got more work to do together so that we continue to succeed on this mission. I would now like to turn it over to Secretary Sudders. Thank you.
Governor, Lieutenant Governor, and good afternoon, everyone. As you've heard from all of us, we're frustrated about the demand for vaccines and the federal allocation, the supply that we receive. Last evening, for the very first time of Massachusetts receiving 110,000 doses a week, we finally received a very modest increase of our supply by 29,000 first doses. So for next week, we will have 139,000 first doses, the first very modest increase in a long time. I'm going to provide an update on COVID-19 vaccine scheduling resources, run through the 2+ certain medical conditions, and vaccination of residents and staff of low-income and affordable public and private housing, and give some insight on funding to support vaccination in historically underserved communities. Since the launch of the COVID-19 vaccine scheduling resource line on February 5th, there have been 42,000 telephone calls. They've resulted in 9,500 appointments scheduled. On average, there are 4,000 to 9,000 calls per day during the week. Last Friday, we announced the expansion of the call center for weekends. On Saturday and Sunday, February 13th and 14th, the call center averaged about 1,000 calls each of those days. Today, as another 1 million individuals become eligible for a vaccine,
With that population.
Governor, could I ask you about maybe pushback from towns? I guess
Say again?
There are about 68 towns that are no longer going to be able to give out vaccines. Are you going to expect any pushback from them? And how does this streamline the process not sending vaccines to an individual community?
Well, keep in mind that we hope and anticipate that a lot of folks at the local level who aren't part of a collaborative or who don't want to be part of a collaborative will continue to help us with hard-to-reach populations, okay? We know there are people out there who are just going to have trouble getting to any site, and that's one role we believe communities are best suited to solve for. Part of our goal here is to, the big lesson we've taken, we started with a very deliberate and very particular, and I would describe as very equitably framed process at the beginning of this. But the big message we got from the public was vaccinate, vaccinate. And there's no question the fastest way to do this is with high volume sites. Now, it's worth pointing out that we have 4 county collaboratives right now that have been operating for several weeks in Berkshire County, Barnstable County, Franklin County, and Worcester County. There are 3 of the 4 counties that have exceeded the statewide average in the number of people in their communities who've gotten a first dose. Berkshire County is number 1. They're over 15% of their community, their county has received their first dose. Franklin County is number 2. No, Barnstable's number 2. They're at 14. Franklin County is number 3. They're at 13. So those regional collaboratives, which have now been running for several weeks, the county-wide ones, have proven to be pretty effective. And there are several other collaboratives that are smaller. I think we have what? I want to say like 13 or 14 all in, 13. Sort of hard to reach areas. There's not a lot of other options or availability there. They work because we can give them a significant amount of supply and they can dish it out in their communities and make that work effectively. But if we're going to do a lot of people quickly, you got to be doing more than a couple of hundred, one site at a couple hundred a day across, multiple sites. You got to be doing, well, I think the regulations from DPH are 750. You got to be doing at least 750 a day.
So does this mean a site like Marshfield, and I asked about it to my parents,
Marshfield is a regional site.
regional, so it can't, but does it have to be open to the entire state, or can they stick to 10 towns or something?
They need to be open to the state, but let's face it, most of the folks who are going to go to a site like that one are going to live in Plymouth County. I mean, I talked to some of the folks from that site over the weekend, and they basically serve, what I would describe as the area around them. Most of these places do, but none of us want to get one more phone call from somebody who says, the closest site to me, right? Closest site to my mom, all right, is the next town over, which is in a different county. And she couldn't go there. That just doesn't make any sense.
Can you explain a little bit more? If a local municipality opens it up to non-residents, would they potentially?
You gotta deliver on the volume requirements here, because, this is about speed. The faster we get through, the higher the number of doses we deliver every day is going to drive how fast we get to the next group. And the one thing that the experience of the past 3 weeks has demonstrated is, larger enterprises can deliver a heck of a lot more vaccines more quickly, which is really important.
Can you explain a little bit that they have two medical conditions? Do they need a referral from the doctor, or is it the honor system?
It's an attestation process for the comorbidity determinations, and I've talked to governors, Secretary Sutter's talked to Health and Human Service secretaries in other states. It is based on an honor system, and I can tell you that based on my conversations with other governors, people for the most part, and I've said this many times here, they follow the rules. People do follow the rules. And will there be examples or incidents or circumstances where people don't? Maybe, but I think the overwhelming majority of folks try to be honest about this stuff.
Is there going to be a way that you will monitor to see if people are following the rules, and if they're not, would you make changes?
Well, in the attestation piece, that would be a tough one. I mean,
So there's no way to check.
well, if somebody shows up and says one of their, if somebody were to show up at one of these sites and they were to attest that one of their two comorbidities was obesity, and they, were built like you, Steve, that obviously they probably would not be able to do that. But I think the goal here is to recognize and understand that other states have been in this same spot, and everybody's kicked around a million different ideas about how to create structure around this, and in the end, people basically decided that the honor system was the best way to go.
How much of a role did public pressure play in your decision to move forward to this phase? You said the big message you got for people was to vaccinate. So did that play a role?
This is actually, in the guidance we put out back in December, this is about when we said we were going to get to this phase, the 65 plus. It could have been 1 week or the other, but it was basically the end of February. So we're pretty much consistent with where we thought we were going to be.
It didn't play a role?
I wanted to make sure we got a lot of 75-year-old plus people through, and, thankfully we have.
Governor, we've learned the legislature's new COVID-19 committee is planning an oversight hearing on your vaccine distribution program. Your response to that, defend it.
When we talk all the time to the legislature, I talked to the Speaker and the Senate President over the weekend. Mary Lou does calls at least once a week with both the House and the Senate. We provide them with a lot of material and information, and obviously we'll look forward to talking to them about this.
The narrative for a while was that Massachusetts trailed the nation in vaccinations, and this was going terribly. And now we're hearing about top 10s and moving up the leaderboard.
Number one among those top 24 states that have more than 5 million people. Yeah.
Moving up like Tiger Woods on the leaderboard, right? So what changed? What did you do to change this and get the state headed in the right direction on vaccines?
Well, keep in mind that we said at the beginning of this process that we were going to be slow out of the gate because we were focused on some hard-to-reach populations. I mean, I can get plenty of people from the mental health and developmental disability and homeless community here, and we could line them up from one end of this room to the other, and they would tell you why they were both surprised and relieved and grateful that one state chose to put those folks at the head of the line. That didn't happen hardly anywhere else. And you're talking about hundreds of sites. I know it's thousands. I was just making sure I didn't overplay my hand there. But, and we were also one of the few sites that made a decision to go vaccinate within our correctional facilities. We were also one of the few sites, one of the few states, and I think, again, we may have been the only one that put PCAs, personal care attendants, and home health aides at the top of our list. And one of the reasons we did that is because PCAs and home health aides work with, in most cases, either seniors or other people who are not senior, who are dealing with other disability issues, and are in constant contact with them. And we felt it was important to vaccinate them so that they didn't make the people that they were looking to serve sick. And we also put, the federal program around long-term care and SNFs was a federal program, but we put a lot of work into making sure that that was done in as thorough and as aggressive as it possibly could be. And it took longer, but we got 90% of our residents in SNFs vaccinated, and I think almost 70%, 80% of staff, which is literally like 30 points higher than the national average on that one. But that stuff took a long time. So I knew coming out of the gate we were going to be slow, all right? And our goal was to pivot to this regional collaborative, high-volume process after we got done with those groups and healthcare and hospital workers. And frankly, the people in Massachusetts also responded to this. They signed up, they got appointments, and they went, and they got vaccinated, which is good.
Are we doing enough to address vaccine inequity? There's a group that's having a news conference in a little bit saying that as of last week, white residents have received 12 times more doses than black residents and 16 times more doses than Latinx residents. Are those numbers accurate, and is the state doing enough to address their concerns?
Well, one of the reasons Commissioner Burrell reached out to those 20 communities personally is to say that we're going to work with them to figure out how we can enhance vaccination efforts in those communities. Generally speaking, our numbers relative to the rest of the country in terms of percent of the population that's black, percent of the population that's Asian, percent of the population that's Latinx, our numbers are better than the national averages, okay? But the national averages are nowhere near where they should be. That said, there's also a significant number of people, as we've been collecting this data, who are listed as unknown. And so one of the things we've asked the Department of Public Health to do is to take the folks who are listed as unknown and figure out for us where they live, because we do know the zip codes of the people, generally speaking, because, tell us where you live. And I want to see what that data looks like so we can draw some conclusions about both how to improve our process and where some of those folks who got listed as unknown actually live, so that we can at least estimate if they belong to certain communities or not. But we're going to continue to invest in the local delivery systems that are the trusted delivery systems in those communities. We're also going to develop, hopefully with them, some campaigns that may even involve, door knocking and stuff like that, to try to see if we can get folks to come get vaccinated. So yeah, we have a lot of work to do here. We agree.
Is this still an issue of reluctance upon some of these people to actually take the vaccine, not so much that they can't get an appointment?
It's hard to tell. I think there were appointments available at the Reggie Lewis Center over the weekend, right? And we worked hard with a lot of our colleagues in Boston to try and get folks there. And we've even set up, the city of Boston has set up days or times that are particular for folks in the community and that are available to sort of trusted voices in those communities to bring people to get vaccinated. But we definitely have work to do there, and we know that.
Governor, today you expanded out the eligibility to people who suffer from moderate and severe asthma, even though that's not included on the CDC's list of exacerbating conditions. Why don't you extend that to conditions like type 1 diabetes, hypertension, and those other things, other conditions listed that might exacerbate those?
The main reason we did this with asthma and sort of went away from the CDC guidelines is it really is an environmental and economic justice issue. There's tons of studies that have been done that demonstrate that at-risk communities and communities of color have historically had higher rates of asthma, child asthma, adult asthma, and a lot of that has to do with decisions that were made years ago with respect to how people chose to build neighborhoods and communities, and it's a legitimate issue, and we view it as much as an equity issue as a medical issue.
I'm saying that those same inequities exist in things like type 1 diabetes, though. Are you considering adding those conditions in as well? Is that a conversation that's happening?
I really want to make clear to people that this asthma issue needs to be dealt with now. If we get guidance and advice from other folks in the medical community about other stuff, we'll certainly take it under advisement. But this asthma issue is a legitimate issue, and it's a legitimate equity issue, and we want it dealt with right out of the gate.
Governor, were any of the sites doing anything wrong? Were any of the sites doing anything wrong as far as letting people get vaccinated who may not have had the appointment? We were starting to have a hearing at the Danvers, but was that corrected, or now is everybody on the same page?
Boy, I think so. I mean, keep in mind that, we get a lot of phone calls from people saying, I saw somebody at a CVS or a Wegmans who was getting a vaccine who wasn't over the age of 75. Well, they could be a healthcare worker, they could be a PCA, they could be a home health aide, they could be a lot of different things, and they would still qualify. And I think, again, I think people for the most part are anxious to get vaccinated. I also think people for the most part have, since the beginning of this thing in Massachusetts, the overwhelming majority of people have, tried to play by the rules, whatever they were. And if we come across providers who are not following the guidance and the rules that we've developed, we'll deal with them.
Are you okay with the Cape Cod situation? Do you think Dartmouth satisfies all those people even on the outer Cape?
Well, the thing to remember here is that Barnstable does have a collaborative in place. It might feel more like a competition to the people who are in it, but it is a collaborative. And between Cape Cod Hospital and the community health centers and the local Board of Health in Barnstable, as I said, they are currently sitting at 14.2% of their population vaccinated, which makes them second only to Berkshire, in terms of the number of people in their county who've been vaccinated with one dose so far. I mean, they're performing well, and we'll continue to work with them to expand capacity and to make sure they have access. But, and they've also gotten, some of this county stuff will be up on our public report. Is that tomorrow? Okay.
Governor, most of the congressional delegations, several congressional delegations called against the pre-registration system. Your thoughts as more people continue to call for that kind of...
Yeah. The hard part, first of all, we're looking at it, and we're talking to folks in other states. The big challenge with that is if somebody is within 10 sites, it's very hard to figure out the algorithm around how you would actually structure that on a pre-registration system, especially if you're talking about 3 or 4 weeks, or maybe more, depending upon the size of the universe that's eligible. What would be really great, from my point of view, with respect to the congressional delegation, would be this issue around visibility, right? I would love to have the congressional delegation urge the Biden administration to give states 3 or 4 weeks of solid, committed visibility into what's coming. Because if we could do that, right, we could then say to people, it's not just next week that's available, it's the next 3 weeks or the next 4 weeks. And people could go on the site and they could take all of the sites that might be near them. And remember, there's a lot of sites that most people have access to at this point. They could figure out if they want to get it first week, second week, third week, or fourth week, work it against whatever's on their own schedule, and book it. And this, to me, in some respects, we get the message we get from the feds is you're not going to get any less, right? Which is helpful, but it's not. You can order now, 3 weeks out, 4 weeks out, and that order will be validated. Because if we could do that, then we could make decisions about where the vaccine is going to go over the next 3 or 4 weeks. We could say that to the provider community. People could then put appointments up on that, and people could then book on that. So what I would really like to have the delegation do is push the administration to give states a bigger window to book appointments, because that would, many cases, would solve for a lot of people the complexity about getting an appointment.
If you know you're not going to get any less, can't you then just maybe book out not all 100% of the appointments, but maybe 50% or 75% of the appointments, so somebody can go on now and say, yeah, I'm going to go in 2 weeks, and book those now, and as you get closer, then add them?
So there are two issues associated with this. The first is certainty is way better than maybe, all right? The second is if you had visibility on how much you were going to get, you could basically distribute a bunch of it out and tell people, you're not going to get any less than this. And you could put 75% of it out there and say, that's hard and that's solid. You got nothing to worry about. And then you use the other 25% as time goes by to figure out, based on how people choose to schedule appointments, where you need to move it from one place to another. But without the certainty, it's really hard to create the same certainty among the provider community that's actually administering the vaccines and staffing their sites about what's actually going to be there for them. And the last thing we want to do, the last thing we ever want to do here, is end up with people booking appointments. I mean, this happened in a lot of other states where people booked appointments and then they got told either the day before or the day of that their appointments, like thousands of them, weren't going to be there for them because there wasn't any vaccine. So the one thing we've tried to say from the beginning of this is if you have an appointment, you're going to get a vaccine. And I just want to make sure that we continue to be able to do that going forward.
Thanks, guys.
Thanks, everybody.
People in the 50 to 64-year-old age group that still have a higher death rate than the general population. Was wondering if we might be further breaking down the age requirements for getting the vaccine, or will they eventually be competing with 20-year-olds to get vaccine?
Well, keep in mind that as we go through this process, particularly when we get into particular targeted groups, like doing staff in congregate care and, folks with mental health issues and developmental disabilities and homeless folks, we've already vaccinated a lot of people who are under the age of 70. People who work in hospitals, the folks who work in nursing homes. We've vaccinated PCAs and home health care aides. We've already vaccinated a lot of people who are under certain ages. The one thing we have also learned through this process is you've got to be really simple, because these are big numbers and it's something people are really focused on. And so from our point of view, the nice thing about going from some of these targeted groups that we felt we really needed to get to for public health purposes to the age groups is, age is pretty clearly defined. And I think from our point of view, that's a better place to be. When we get into some of the other, the employer categories, obviously, you're going to get into populations, hopefully at that point, that are mostly below the age of 65, because we will have dealt with, through the housing stuff and the long-term care stuff and the assisted living stuff and the existing appointments, a lot of the folks who are over the age of 65 to begin with. And then you're going to end up in a situation where you are talking about 65 and less. But we've already vaccinated a lot of people who are between the ages of 30 and 40 who work in, group homes and work in nursing homes and work in emergency rooms and hospitals. So I kind of like doing this age piece, especially since so much of the COVID data demonstrates that people over the age of 75 are the most at risk of losing their life, and people over the age of 65 are the next most at risk.
Thanks, guys.
Thanks.
Thank you.